day. I'm Ruth Bowick and welcome viewers to Healthcare for 55 Plus. Today my guest is Leelan Pearson, Audiologist at Northern Hearing down at Kenora's Harbourfront. This informative program is thanks to Shaw Spotlight, and I'm so pleased that Shaw Spotlight has invited me to be the interviewer with a number of professionals involved in pertinent healthcare for area seniors. I will add, I am positive that everyone viewing this show, not only seniors, will glean a great deal of wonderful information on what the professionals in this program have to offer. So to get started, I am delighted to introduce Leelan Pearson. So welcome, Leelan. May I call you Leelan during this interview?
Yeah, that'd be great.
Thank
Ruth.
you very much. Okay, so now I'm going to start right off. This is important, I think. When should a person get their hearing tested?
Yeah, so if there's no obvious signs of hearing loss, it's probably good to get a baseline hearing test between the ages of 50 and 55, somewhere in that range. And that's usually when age-related hearing loss may start to show subtle signs. So it's good to get a baseline, and then after that point, if you're retested, you can see kind of what changes have happened over time. And actually the best predictor of the future is looking at the past, so you can kind of help you predict or extrapolate and get an idea of what may transpire in the future. But other reasons to get tested, certainly if you're showing some of the obvious signs of hearing loss. So some of those would be if you find that people are mumbling to you, if you're having difficulty hearing with some background noise, turning up the TV volume louder than others. Another thing might be if there's ringing in the ears, might be good to get your hearing checked. And then just keep in mind too, though, that sometimes it's other people that notice the hearing loss, maybe more than the individual themselves, because it does tend to be gradual. So if somebody's suggesting that you should get your hearing checked, it might be time to get your hearing checked as well.
So that's some of the question I was just going to ask you. What are some of the signs of your hearing going? So it could be from your own self thinking things are blurry or something in the ears, or it should be someone saying to you, Mom, like to say, Mom, are you not hearing me? Things like that. So
that's right.
That was really good to add on that little bit. So what would be the consequences of an untreated hearing loss?
Yeah, so everybody can think of the obvious consequences of an untreated hearing loss, such as asking people to repeat and turning up the TV louder and maybe having some trouble hearing and some background noise. But there are some more significant consequences, such as if you're not hearing well with some background noise, well, you're going to tend to avoid social environments that are going to make you frustrated or maybe embarrassed. So people tend to isolate themselves. That can result or exacerbate things like depression. And then maybe more importantly, they found recently, in the last few years, a lot of studies have been showing there's a strong link to dementia with an untreated hearing loss. So with significant hearing loss, somebody might be up to 5 times more likely to develop dementia than somebody who's normal hearing or treating their hearing loss with hearing aids or other devices. Yeah.
So that's one of the things too with dementia that leads to Alzheimer's too then, if you're not careful.
Well, dementia and Alzheimer's are a little bit different. So Alzheimer's, people will have dementia with Alzheimer's, but dementia is kind of there's some differences. So you can have dementia without having Alzheimer's.
Oh, I was under the impression. So again, I learned something every time we tape a series here with this professionals, because I thought dementia led to Alzheimer's. I didn't realize that.
They're different. Yeah. And
I'm glad you read about the hearing background, because it just so happened that last night, and this was the first time I've ever experienced this. I was at a great big do. There was about 100 people there, having a really nice steak dinner, and the gentleman was sitting across me was telling me, about, we were just kind of talking. And so I asked him something, or I said something to him, and he sort of looked at me. And so I said it again, and then I said it a third time. And then finally, I don't know if I was rude or not, but I looked right at him like this. I said, "Are you not hearing me?" And he said, "I'm not." He says, "There's so much background noise here." He says, "And I've got hearing aids." So then, of course, I felt very stupid and very rude, But anyways, he understood, because it was the background noise
That's right.
And no matter how I raised my voice, it didn't really help, because there really was a lot of background noise.
Yeah.
So I'm glad you brought that up.
Yeah.
So that's one of the things and that's the first time I've ever experienced that myself personally.
Yeah, yeah. So
So now I'll be more understanding if someone,
Yeah,
you know.
and depending on the severity of the background noise, but also the severity of the hearing loss with the sensory neural hearing loss, you know, with that particular type of hearing loss, people will still have difficulty in background noise. So, you know, especially when you get moderate or severe hearing losses and that.
See, someone doesn't have that problem, wouldn't realize how background noise affects you, because it didn't bother me, you know, all this yapping going around by 100 other people around me. So, but for him, it did. So I'm going to go on now, because what does a hearing assessment involve? Now, so we're finally going to get an appointment with you.
Yeah.
And what are you going to do to us?
So first, I take a medical case history, get some information from the person. Then I have a look in their ears, so we call that otoscopy. Then we move into the sound booth where we do some speech testing, as well as play a series of beeps to somebody from low pitch through to high pitch. We do that both through air conduction and through bone conduction, so that all that information will allow us to determine the type of hearing loss. There's more than one type of hearing loss, the severity, the shape of the hearing loss, and allows us to then make appropriate recommendations or counseling. So, you know, there are some types of hearing loss that might be surgically correctable, or maybe the person needs to see a specialist or something like that. So it allows us to make the right recommendations. But in addition to a hearing test, sometimes a good starting point for some people, especially if they're unsure if they have a hearing loss to start with, might be just a hearing screening. So we do that at Northern Hearing for no charge, but somebody comes in and we play them the beeps from low pitch through high pitch, and it would give us the shape of their hearing, whether it's normal hearing or hearing loss, and kind of the severity. And if there is some hearing loss, I'd recommend a full hearing test at that point.
Okay. Is that the booth there you're talking about? Is that it right there?
Yeah, so we have a sound booth here, yeah.
Oh, so you must have there, and that's part of the equipment there right there that I can see on the desk?
Yes, we have the audiometer.
It does, like, when these sharp beeps, something will come up on the screen, and so you know exactly what's going on in the person's ear from that little machine there. Oh,
yeah,
okay.
That's right.
Very good.
Yeah.
The sound looks kind of like, I'd like to go in and see what it looks like. Is it just like it looks inside, like from the window? There's a seat in there that you could sit down.
Of course.
You don't have to stand.
That's right.
Okay.
Yeah.
Well, anyways, now here's something this fellow I was talking about, you know, with the background noise. He had a hearing aid. So now I'm sure that I remember, because I'm old enough to remember when the great big hearing aids hung on poor people's ears. Like, they weren't poor, the people weren't poor, but I felt they were, because must have been just very obnoxious for them. So they must have, not only they must have, I'm sure they've changed a lot, have they? Would you like to explain what the hearing, now I guess you could get something that fits right in the ear, you don't even see it. Explain that to me, please.
So hearing aids have really come a long way. Even in the past 10 years, there's a huge change with hearing aids. So, you know, if I listen to a hearing aid from 10 years ago or longer, even if it was in good shape, it's going to sound kind of like a poor quality speaker compared to a good quality speaker. So just the sound overall is much, much improved. But then there's a lot of other features that have made it more user friendly. You know, something like... You have
something here?
Yeah, so this would be new hearing aids here, and this is a charger with lithium-ion batteries in the hearing aids, and that's really seems to be the way to go. Yeah. So
this part goes in your ear. The little silver thing.
The rubber end would go in the ear.
This goes in that little tiny thing like that.
And the small piece on top of the ear, and basically it becomes invisible once you try it on. I was actually thinking maybe I should wear one and see if you notice, but I didn't. But anyways, what the charger would be plugged in. The lithium-ion hearing aid just drops in there at night.
So is that the battery then?
Yeah. Okay. So then it would.
And where does that? So that little thing goes in your ear, but where does that go? Hang behind it?
Yeah, it hides behind your ear.
So you would see it if you were looking.
Well, you'd be amazed at how invisible it is.
Oh, really?
Yeah.
How come one's red and one's blue?
Well, red for the right ear and blue for the left.
Well, that's good. So you don't get. So you mean, so the ears could be different in hearing, so that's why you got to know to put the blue in where it should be in the left.
Of course.
Okay, I see. Yeah. You're telling me all. And what is this? It looks like a microphone or something.
Yeah, so this is a drying system that this charger has combined with it. So it'll just dry the hearing aids when it's closed at night and charging. It takes 3 hours to charge and holds over a 20-hour day. In addition to being able to charge these hearing aids can do other things, such as streaming Bluetooth.
I was going to say, turn it up so the other way, like, yeah, so that
Yeah.
the camera can get a look at that.
So
and then there's even little brush. Is that to clean the red and the blue things?
So these hearing aids can also stream Bluetooth from the TV, can bring it into the hearing aids.
Oh, really? Isn't that interesting?
Or use something
You
like...
got something else?
Well, I brought... I've got my smartphone here just to show you that you can also download a free app to adjust your hearing aids really discreetly. So you could be at a dinner party, nobody knows what you're doing, and you could say turn up or turn down the volume, or
If you don't like what you're hearing,
change some other things. So it gives you some flexibility. Remote controls have been around for a long time to adjust hearing aids, and they still have those, but this is just something a little bit extra, and it's easy to use. I set it up on people's phones all the time, show them how to work it.
Oh, you can do that for them.
And it's just really nice
as long
and
as
easy
people have
to
the cell
adjust.
phone, you can.
Yeah, any of the smartphones can be used. So
okay. Oh, that's a smart.
doesn't matter if it's an Android or an iPhone. It doesn't matter. Yeah.
Well, that is. Oh,
Yeah.
I'm very surprised. Everything's on computer, little tiny things now that you can do.
Yeah,
Because I remember
technology.
sometimes, sometimes maybe they're old hearing aids, but I've had this happen in church. I've heard it in church. All of a sudden, someone's hearing aid starts screeching. Why?
So that would be,
Is that an
again,
old
that
hearing
would have
aid?
been an old hearing aid. So the new hearing
very
aids.
annoying.
Yeah, so they don't do that anymore. You know, I would never let somebody out of the office if they were whistling away. But yeah, so what's happening there is the sound going into the ear is leaking out. Now the new technology, that's why we can get things like, you see this rubber end has a bunch of holes in it. I don't know if you get that on camera.
I can't believe that's so small.
Basically, the older hearing aids used to have big pieces in the ear to plug the ear so sound wouldn't. But now the technology's there. Yeah, so
isn't
it
that
really makes
amazing?
a big difference.
How oh my goodness! Well, it really has come a long way.
Yeah.
So let's see what else I can ask you that besides. So what are your biggest factors in having success with hearing aids? Now, I think can it get much better than that?
Well,
Probably,
you know, obviously having something discreet because everybody wants that and user friendly like that. But success, I'd say that right from the get go would be to have the hearing aids fit appropriately to start with. So
you can do that here.
This computer, does exactly that. So I can put somebody's hearing test into the computer. So again, when we're playing the beeps to them in the sound booth and low pitch through high pitch and find the softest beeps they can hear, I plot that on here. Can put their hearing aids on with little microphones in their ears, very, very tiny microphones. Is that all done in
the same appointment?
It's done on a separate appointment, a fitting appointment.
So you do all that in there first to get all those beeps and everything, and then the next time they come, you'll have it.
Yeah.
Oh, okay.
And so then I can see exactly what they're hearing. So as you can see on here, we have the hearing test, and then the recommended targets to set the hearing aid to, and then there's average speech, and we set it to connect the dots essentially, and that allows somebody to hear as normally as possible with their hearing aids. So that's number one, and surprisingly, there's actually quite a few clinics that don't even use that technology, but it's definitely an important thing that I think is one of the most important things you can do. And then the second one of the other important things that needs to be done is for the person to wear it consistently, and I can't emphasize that enough.
Because I think a lot of people do where they want to take it off for a while or something, and they really shouldn't.
The first couple of weeks, it's really important to allow your brain to adapt to hearing things differently, especially if you've kind of put off getting your hearing aids for a while to start with. Of course, you're going to hear things differently. You might hear your voice a little differently. You might be aware of environmental sounds that you wouldn't otherwise have heard, like your turning signal and things like that. And it does take a little bit to get used to. So if you're on and off with the hearing aids all the time, not getting used to it, you know, your brain will always be very alert to new sounds and sounds that are, you know, but if you wear the hearing aids consistently for a couple weeks, you know, when you're walking through the leaves, you're not even going to notice some crunch under your feet. Your brain's going to be all adapted to that. And then you just hear speech and TV and other things better. So, it requires a little bit of work there just to get used to them for some people. So definitely a reason why not to wait too long to address the hearing loss. It's better to address it in the early stages so that transition is more seamless. It's not such a big jump for somebody to try and get used to. And then one other point I'll say is that to have success with hearing aids, you do have to come in usually every 2 to 3 years to get your hearing aids adjusted to new hearing tests, because hearing loss is gradual. It doesn't stop. It may continue to progress, and it's not like you need new hearing aids, but you just adjust the hearing aids that you have. Again, using that equipment, and so it's, again, when 10 years down the road, it's not such a big jump if you do get them adjusted. It's a nice, again, seamless transition. So
you should, just like anything else, make your appointments couple. You said 2 to 3 years.
Yeah, 2 years is a good timeline for most people. Yeah.
So when you come in, the people and that thing, they're with you watching that screen to know how they're. Oh, so they actually can see for themselves.
They can see exactly what the hearing aid's doing,
really wonderful.
And that helps with counseling too, because especially, again, if somebody's waited a bit to get their hearing aids, we might have to set it a little bit below what's recommended. Oh. And at least you can counsel them that, hey, you may not hear, TV at the same volume as, your son or something like that, but this is why, and don't worry, we can work towards that in future appointments. So, so I guess,
but you really should take your hearing aid off at night. So do you want to keep it in 24 hours a day?
No. You do take it off at night.
Okay.
So again, that's where you go into the charger. They still have battery models that you can open the battery door at night, but definitely the charger's been a huge plus to anybody who's tried the new lithium-ion.
Well, I'm still not sure this got to plug into something electric.
It does, yeah. Sorry, I didn't bring the wire here.
But there is. I'm thinking that isn't just it. You got to plug it in just like your cell phone. You got to plug.
That's right, and it can have a battery pack attached to it too if you're going traveling or something. Yeah, so there's lots of great
difference
options.
from when you read old books where they had a big horn coming.
Well, yeah, I think we're
a long way.
But even in the last 10 years, it's been pretty amazing.
Well, I can believe that, because sometimes I've seen people say with that big thing hanging out of their ears, and look at this, I can't believe how little it is.
Yeah, you wouldn't notice it on most people, that's for sure.
No. Good. Now, here's the thing, cost. Is there a funding available for hearing aids? Does OHIP pay anything?
Well, it's called the Assistive Device Program. So the Assistive Device Program provides currently up to $500 per year towards hearing aids, and they do that every 5 years at this point. And then people may have medical insurance, and they typically provide some funding for it. And then you can put all that, any additional cost, on your income tax as a medical device.
Oh, that's good. You can get a bit of a write-off.
So there's some funding for most people. And then there's other sources. So somebody who's worked in noise. Again, we have a lot of, in the north here, a lot of noisy industry. People who've worked in factories,
and sawmills, and
paper mills, and power tools, and heavy equipment. So those people, through a hearing test and just, again, our medical case history, we can see whether they're a good candidate to apply to workman's compensation. It's an EG process which we walk them through, and those people would be covered for life for hearing aids and get replacements every 5 years. Other things, veterans are covered for their hearing aids.
Okay. If they serve their country, then they get that benefit.
That's right. Yeah, and so people with disabilities, there's some funding there, as well as non-insured health benefits, First Nations, and so there's lots of different funding sources. So it's worthwhile coming in, and there's a lot of different options that we have here as well.
But if someone has to pay cash, do you have a payment plan? Because I don't think these things are cheap. I'm sure if you want to hear, you've got to spend some money. So if you have a payment plan in case... Yeah,
so we have a couple options there. I mean, we do have kind of one that we run through our own clinic, no interest at all, and just allows somebody to do it over a few payments.
Well, that's nice.
If somebody wants to spread it out longer, say over a year or something like that, we deal with a company that strictly deals with medical equipment, and they can pay interest-free over a year. So there's different things, and it's a very easy process to apply, and it usually, what you're allowed to get within 20 minutes or so. So it's quite an easy process.
Oh, that's good, because I wouldn't want someone, because I don't know, and I don't want to even bring money into this, because that's something between you and your patient. But You know, so, but it's nice to know that there is some help available, and if there isn't, there's a payment plan with no interest. Not like the bank where you got to pay higher, or the Visa bill at 18% interest.
That's right.
So you're very generous in that.
Yeah.
So that's very nice. Yes.
Yeah.
Okay. Now I'm going to go on to another thing now, and I've asked this a few people, especially dentists, I think, and optometrists. So I'm going to ask you, as in hearing, should children may have hearing problems?
Yeah.
And how would the parent know? Because they might just think, well, they're just not paying attention, or they don't care to hear you, what your mother and dad are trying to tell you. So is there some kind of a signal that parents should or could be aware of that should prompt them to come in to see you, an audiologist?
Well, the great thing, Ruth, now is that there's an infant hearing program. So there's actually screening done in the hospital for every child after they're born.
Oh, is there?
Yeah, so that's been around for a number of years now, probably 15 years or so now, or if not longer. And so usually there's an indication there. However, hearing loss can happen at any age, and I do have children who do wear hearing aids, and you know, I'll be honest, I've even tested my daughter because
just to be sure. Well, I hope you do.
You know, they oftentimes will ask you to repeat quite a bit, or but yeah, if there's any doubts, again, a screening, like I mentioned before, where you play some beeps and get a sense whether their hearing is normal or if there's some hearing loss. That's an easy thing to do. But again, if there's any concerns, if say there's delayed speech, that's usually
another thing that they should come and see an audiologist. Yeah.
A lot of times it'll show similar symptoms to attention deficit disorder. So a child in class won't be paying attention because maybe they can't hear adequately. So it's a good thing. And again, a lot of the schools often recommend children to come in for hearing tests as well if they kind of notice that.
So I hope parents that are, I say this is for 55 plus, but if parents with young children are listening to this, happen to catch this show as well, and they think they might have a problem with their child, well, there you go. You've just told them, you know, exactly what to look for and how to cope with it. So, well, thank you so much, Leelan. Now, that's really, really nice of you to take the time to be with me today for Shaw Spotlight. And I shall return.
Thanks for inviting me, Ruth.
Oh, you're welcome.